my name is Janice Nichols. I'm a student with Youngstown State University, and today I am going to be doing a blood vessel and abdominal assessment on my patient. Can you introduce yourself, please?
Hello, my name is Brandon.
First, before our video started, I did do the pain assessment and a vitals assessment. His temperature was 97.9 degrees Fahrenheit. His pulse was 70. His respirations were 16. His blood pressure was 136/90, and his pulse ox was 97%. He is 6 foot 1 inches tall, and his weight is 238 pounds. His pain scale today is a 0 out of 10. Okay, so first, while he's sitting, I'm going to inspect his neck here for any jugular pulsations or any distension, and then I'm going to start palpating his pulses. So I don't see any distension, I don't see any pulsations. So we'll start with his carotid. Regular rate and rhythm. Good contour. Good amplitude. Now we're going to move on to the brachial. Again, regular rate and rhythm. Good. +2 pulses bilaterally, equal bilaterally. Now we'll do radial pulses. Good. Good. Pulses are equal bilaterally. Then we will do popliteal. Send your leg for me. Good. Regular. Good. Equal bilaterally. Then we move on to posterior tibialis. Thank you. Good. Good. And finally, we move on to the dorsalis pedis. Good. So all of his pulses were normal rate, normal rhythm, normal contour, normal amplitude. They were equal bilaterally. So also we are inspecting his legs for warmth, any tenderness.
Nope.
Okay, so there's no warmth, no tenderness, no pitting edema. He does have a little bit of venous insufficiency as evidenced by some varicosities. Okay, now I'm going to have you lie down. I'm going to make sure that we're still in the camera here. And then I'm going to begin by auscultating the rest of the fever pulses. So starting with his abdominal aorta. And then moving on to his renal arteries, which are 2 centimeters above and just to the left and right of the umbilicus. Moving on to his iliac arteries, which are 2 centimeters below the umbilicus and just to the left and right. And then finally, the femoral artery, which is in the groin. Perfect. Thank you. So I didn't hear any bruits in any of the arteries. And that's it for the blood vessel assessment. So now I'm going to move on to abdominal. While I have him laying, I'm going to go ahead and auscultate all of his bowel sounds. beginning with the right lower quadrant. Then the right upper quadrant. Left upper quadrant. And left lower quadrant. Vowel sounds are active. And now I'm going to move on to percussion. Before I do that though, I am going to have him can you lift your head up off the pillow for me? I'm inspecting the belly currently for any hernias, separations, or masses, which there are none. Go ahead. Okay. Okay, and then I'm also, after I percuss all 4 quadrants, I'm going to percuss for the liver border, starting at the mid-clavicular line, working my way down. Okay. And then I'm also going to percuss over the spleen area to make sure there is no splenomegaly. Okay, no splenomegaly, liver border is as it should be. Next, I'm going to do some palpation, starting with light and then moving on to deep. Any tenderness?
Nope.
Okay, and then moving on to deep palpation, so I will be palpating for the liver and the gallbladder in the right upper quadrant, palpating for the spleen in the left upper quadrant, and then I will palpate the umbilicus and the umbilical ring for any hernias or masses. Okay, so there were no felt masses, no splenomegaly, and no hepatomegaly either. So now I'm going to have him sit up again. There were also no aortic pulsations when I was palpating. And finally, I am going to percuss his costovertebral angles for any kind of kidney tenderness. This usually is indicative of kidney stones. Any tenderness?
Nope.
Any tenderness?
Nope.
Okay, so no tenderness at his costovertebral angles. And that concludes the exam. Thank you.
Thank you.